Hello everybody, my name is Tom Timbrooks, and I'm going to be running for United States House of Representatives for Oregon's 6th Congressional District in 2026. That's the plan anyway. I could be dead by then, but just in case I'm not, this is going to be my little speech to you guys out there to vote for me, okay? It'd be really nice if you vote for me. Anyways, I live in McMinnville. I'm a really nice guy. I'm a Republican, and you know, Oregon, well, Oregon's a pretty groovy place. I really like Oregon. I really like living here. And I'm a manufacturing engineer. I see some things going on in Oregon that could probably benefit from the perspective of a manufacturing engineer, mostly jobs, job growth, trying to figure out how to get jobs to Oregon. And that's one of the jobs, one of the things that your House of Representatives people, they're supposed to do in the House of Representatives. There's three main things that the House of Representatives does. One of them is to turn off the volume on the cell phone, so if anybody calls me up during this little thing here, we're not going to be disturbed. But that's actually, anybody can do that. You don't have to be an elected official to do that. So one of the things that your House of Representatives person is supposed to do is they're gonna steer federal funds. See, all the states, everybody in America, they throw money into a big pile, and that goes to Washington, D.C. And whatever money like is left over after paying for, you know, the national infrastructure, the military, all the good stuff that everybody in America absolutely needs, whatever is left over, all the representatives are going to fight over it. And so, you know, whoever has the best argument is going to get more money. Well, see, as a manufacturing engineer, I am very familiar with all of the things that are going to bring federal funds to Oregon. And these federal funds are going to pay for things like artificial intelligence, robotics, cancer research, things of that nature. And a couple weeks ago, I was talking about how Oregon doesn't have any oil refineries. We get all of our gas and diesel from Washington. The Alaska pipeline comes down from the north, hits, you know, here's Washington. They refine everything, and then they send it to Oregon through a big old pipe. And this is one of the ways that Oregon goes around saying, hey, we don't have certain environmental problems because, you know, we're a clean state. We're better than you. You know, well, the fact of the matter is Oregon doesn't actually have any refineries, so that you know, Oregon can say that. We really need some refineries in Oregon. We need at least 3, probably 5, and that was the subject matter of a couple of weeks ago. You know, we need those refineries. So that is the kind of thing that we need somebody in Washington, D.C. to steer funding towards it. And one of the reasons I'm talking about that right now is because here's the thing. The person that holds the job right now, named Audrey Salinas, and I presume she's a really nice person, really responsible person and everything. She seems like a really responsible, dignified, decent human being and all that. But there's some things that she's doing, she's supporting, and it's not that I don't like what she's supporting. I appreciate what she's supporting. I think what she's supporting is good stuff. I just think that I could support things that are a little more important for Oregon's infrastructure, for a little more important to Oregonians, and could actually lend to a little bit more of a economic prosperity for all of Oregonians. So this is one thing that she got on Facebook the other day, and she's talking about how she has gotten more funding for the Newburgh-Dundee bypass, which is a great construction project. Sometimes I forget how to talk. Hold on a second here. This is green tea. I think that's going to help. Yeah, I just had a whole bunch of chow mein. I love chow mein. I don't care. Ooh, General Tso's chicken. I'm over here in McMinnville. The Safeway and the Albertsons They've got really, really good delis where they've just loaded up with Asian food and American food, you know, fried chicken, baked chicken, barbecue chicken. They got all the salads and everything. Man, just thinking about it, I'm going to gain like 10 pounds, okay? Anyways. With the Newburgh-Dundee bypass, she's coming on Facebook saying that, you know, she secured funding for the Newburgh-Dundee bypass thing, and it's a great project and everything. The problem is, it started in 2018, and she didn't actually become a representative until 2023. Now, I don't know if she was part of government before that. I don't know to what part she, you know, took in the Newburgh-Dundee bypass, but her being in the House of Representatives in Washington, D.C., representing Oregon's 6th Congressional District, that had absolutely nothing to do with the Newburgh-Dundee bypass. All of that money was allocated already. The project was already allocated. Everything was already done and ready to go before she ever got into office, okay? And I don't mean to, you know, make her seem like a liar or anything like that. She's not lying to you. She's just... she's talking about good things that have happened since she's been in office, and, you know, maybe she wants to take a little credit for that, but she can't really take credit for that because she didn't really have anything to do with it. So if you're listening to Andrea Salinas, you know, on her Facebook, and she says, hey, this happened because of me, you know, do your research, find out about this stuff. It really isn't, okay? And another thing, she is in with the Equity Caucus. This is my emotional support clipboard. I'm old, I forget a lot of things, and I don't have like a teleprompter here to tell me the script, so I got to have my emotional support clipboard. The Equity Caucus, okay, now the Equity Caucus is a caucus in Washington, D.C., and what they do is they try to repeal any laws that don't respect the equal rights of, you know, men, women, you know, ethnicity, religion, and so forth. See, the thing is, these laws are supposed to be looked at by the state. The federal government has already created all of these laws that say it is illegal to discriminate based on gender or ethnicity or religion or sexual preference. The only thing anybody can discriminate about would be a person's job performance. Are you performing the job? Yes or no? Are you doing a good job? Yes or no? Are you providing the company with a return on the investment? They pay you $100,000 a year. They expect $100,000 a year plus some amount of money. So, you know, they're not allowed to discriminate anyway, and the states are actually required to ensure that federal laws are followed. So being part of the Equity Caucus in Washington, D.C., that's really a waste of time. And it's one of those things where, you know, she joins the caucus so that liberals will tend to vote for her, thinking, hey, she's protecting our rights. She isn't protecting your rights, okay? Your rights are already guaranteed by the federal government. She can't really do anything about that, you know, positive or negative. It's up to the state. The state government is the government that is required to enforce these laws, okay? So her being in Washington, D.C., has nothing to do with whether or not the states are enforcing the federal mandates about discrimination, okay? So, yeah, you watch out about that. And also, she just gave this really big speech where she says, Trump is using Venezuela to distract from the Epstein files, ICE raids, the high cost of health care in Oregon, the high cost of living in Oregon, and some other things. First of all, the high cost of living in Oregon has nothing to do with the Trump Trump administration. It has to do with the fact that companies are leaving Oregon all the time. You know, it's very, very expensive to do business in Oregon, so a lot of companies are leaving Oregon. Dutch Brothers just left. Dutch Brothers started in Oregon, and it's gotten so expensive for them to exist in Oregon that they have changed their corporate headquarters to someplace else. I think it's like Texas, Florida, something like that. So what happens is the state needs the revenue that was coming in because their corporate headquarters was here, so they're going to increase the taxes, the tax burden on people like you and me. And so, see, the state is actually causing the high cost of living. And it's the same thing with medical coverage in Oregon. The high cost of health care in Oregon has to do with the fact that there are certain things. What is it? Oregon has the Oregon health plan, Oregon health care, Oregon health plan, whatever. I have the Oregon health care plan, whatever that is. Yeah, I've got a card and everything. And apparently it's a pretty good plan because if you need any medical assistance, emergency or whatever, it's paid for. Okay, you get into a car accident or something. I knew this girl, she told me she had an ectopic pregnancy, and her ectopic pregnancy was taken care of by some very competent, very good doctors. She was brought into the hospital, everything was taken care of. She didn't pay anything because she was in the Oregon health plan, okay? And so the Oregon health plan is not really very effective because it is run by the government, and the government never really runs anything effectively because the government can't deny anybody anything. They can't. Anyways. So socialized medicine, it's got its positive points because it provides medical care for people who can't really afford it, but it also has its negative points in that a lot of times the health care benefit, it just so much bureaucracy, it actually costs the government a whole lot of money when it shouldn't. Yeah, it's that's the reason healthcare in Oregon is getting more expensive, or our healthcare insurance is getting so expensive. It has more to do with the Oregon government than anything else, okay? It's not the Trump administration. So the Trump administration isn't doing anything bad for the health coverage or for the high cost of living in Oregon. In fact, yeah, the government is, the Oregon government is really doing more for it. I got to make sure the microphone. I'm one of these guys. I'm always checking everything. Okay, just if you put me in Washington D.C., people are going to be reporting on me. They're going to be like, "Oh, Tom Timbrooks, yeah, that guy. Yeah, I mean, everything in his office is nice and orderly." Ooh, you know, I'm probably going to get a couple eyebrows raised and everything. But once again, I don't want to say anything bad about Andrea Salinas. I'm sure she's a decent person. She's trying. And a lot of times, you know, you really have to search for a victory, especially in the political realm, because it's very rarely, anything that happens in the political realm is very rarely the result of one person's efforts, very rarely. And that's by design. It's a good thing. So one person can't do a lot of great stuff, but one person can't really do a lot of bad stuff either. So it's kind of by design that you know, as a representative, you really have to go around looking for any victory you can get. And she's looking for, you know, any kind of victory she can get, because I guess this is her second term in office, and apparently after you do 5 years, so it's a 2-year term, and so she's done two 2-year terms, it's 4 years. After you've done 5 years in the House of Representatives, you get some kind of pension, and I'm not sure what the pension is. I'm sure it's a very generous pension because government pensions are pretty decent and the money's good. So you know, she's done 2 terms. She probably wants, you know, that 5th year so that she can get the pension, and you know, after 3 terms, I don't know if she'll still want to be there or whatever, but a lot of times a House of Representatives person stays in for 3 terms just so that they can get the pension like that. I mean, I probably would. You know, I mean, hey, if I get in for 2 terms, do a lot of good stuff, I'll probably go for that 3rd term and say, hey, you know, why not? I mean, it's for a pension and everything. So yeah, you know, so I can't really blame her. But and I wrote this down so I don't forget it. So in election years, voters often see more messaging and more urgency. What matters to me isn't how often someone speaks, but what tangible outcomes their time in office has produced for Oregon, jobs created, industry grown, and federal investment secured. There's a difference between visibility and impact. Advocacy and social media are part of modern politics, but they don't replace the responsibility of delivering measurable benefits to your district. My concern is not with what's being said, it's what's being built or what's been built. And that's really, you know, if you're really critical on any representative in the House of Representatives, like I said, you're not going to find any one representative in the House of Representatives that's done anything really breathtaking and amazing, because no one person can really do that. It's not, the system isn't built for one person to do amazing things. It's built for a group of people to do amazing things. And the most you can really do to claim a victory is claim it to be part of that group, which, you know, she is part of the Democratic you know, group, the Democrats in Washington, D.C. So as part of that group, I'm sure she's done her best to accomplish good things. You know, but here's the 3rd thing. When representatives focus heavily on national controversy, it often means local opportunities are being missed. Oregon has real assets, technology, natural resources, skilled workers, and those require sustained technical outcome-driven leadership, not just messaging. Election years bring more noise, but Oregon needs more results. So if you feel tired of outrage cycles, skeptical of social media politics, and frustrated by high costs and stagnant opportunities, you might want to consider me, because I have been, you know, making these videos so that you can start to understand who I am, what kinds of things I might bring to the table. Like I said, manufacturing engineer. I really understand the whole concept of bringing jobs to Oregon. I want to bring more jobs to Oregon. I have a terrific plan to bring jobs to Oregon, and I really think that my plans can help out Oregon a whole bunch. Now, one of the things that I plan on doing if I ever get to the House of Representatives, I got a little slideshow for you, and I want to make Oregon's 6th Congressional District America's greatest congressional district, and healthcare as part of infrastructure, breaking the circular problem with AI plus robotics, okay? Now, the problem in one sentence: communities without health care don't attract jobs, and communities without jobs can't support health care. That's a circular problem. What access to health care really means is access has 2 parts: location, where a facility is reasonably close, and affordability, people can actually use it. Without both, access is incomplete. Okay, so why providers avoid underserved areas. Healthcare systems ask, can patients pay? Is reimbursement predictable? Can we attract staff? Will the facility survive financially? If the answers are uncertain, they don't build. The circular trap: no infrastructure, no employers move in. No employers, few insured patients. Few insured patients, no new healthcare facilities. No healthcare, still no infrastructure. So essentially, there's no infrastructure because there's no healthcare facilities. There's no healthcare facilities because there's no infrastructure. So the communities stay stuck. The conventional government response is to subsidize insurance, expand programs, and create new tax credits. The result is more spending without redesigning the system. And this is something that I've talked about before with my top 5 things. The top 5 things that government should work on. Number 1, infrastructure. Infrastructure is everything that a city needs: roadways, bridges, clean fresh water, sewage, fire department, police department, schools, internet, garbage collection, things of that nature. All the stuff that you take for granted just when you move in, okay? I mean, if you move into a place, you just flip a light switch, you're like, hey, no electricity. Oh, we don't have electricity here. Well, I kind of figured if I'm going to buy a house, it's going to have electricity. Well, those things are taken for granted. That's your infrastructure. The most important thing that government can provide is good infrastructure, and this is the number 1 thing that I would work on providing, is that infrastructure, because federal dollars do come into the state to support infrastructure projects. The bypass loop that Andreas Salinas was talking about before, that's one of the things. The federal government does support infrastructure projects like bridges and roadways and bypass loops, freeways, and so forth. We've got a brand new bridge out here in McMinnville, and let me tell you, that bridge cost millions of dollars. There is no way the city of McMinnville would be able to afford a bridge like that on its own. You know, we had to have had federal dollars come in and build that bridge, and it's a nice bridge and everything. So that's one of the things that federal dollars coming in actually supports. So you know, that's the kind of thing that I would work on coming to Oregon. I don't know if Representative Salinas has really worked on that. She hasn't. I mean, that would be one of the things I would mention is, you know, because of me, so many bridges have been built, you know, so I really don't know. It's probably something that was in the plans before she ever actually got there. But let me get on with this. Okay, systems that teach helplessness. The risk of well-intended policy, when government only pays the bill but never fixes the system. Okay, people learn costs always rise, access never truly improves. The only solution is ask for more help. This is learned helplessness at the system level, not a personal failure, a design failure. We built a model where subsidies grow, but capability doesn't. And learned helplessness is a whole psychological principle. Essentially, and it's really nobody's fault. It's part of human nature. You know, it's part of human nature. The parents want to take care of their children. What children learn is, you know, in some situations, what children learn is all they have to do is be helpless, and mom and dad will come along and fix it. And so, you know, they expand us as adults. They tend to expand this whole thing, thinking, well, if mom and dad aren't going to take care of it, then maybe the government should take care of it. And this is where the idea that socialism is going to fix things, you know, comes in. Socialism doesn't really fix everything, but a lot of times younger people like socialism because they start thinking that what socialism is a replacement for mom and dad. And it really isn't. But they think that it is, so they support socialism. Well, this is their desire to adopt socialist policies comes from this whole learned helplessness thing. And learned helplessness is just very basically, if I'm helpless, somebody will come along and fix it. So it's not my objective to learn how to fix things myself. It's my objective to elect somebody who recognizes my helplessness and comes along and fixes it for me using somebody else's money. And that's kind of Ouroboros type thing, you know, the snake eating its own tail. Eventually this whole learned helplessness thing, the socialist concept, is going to consume itself and fail. It's happened before. Socialism always fails. So yeah, learned helplessness is never a good thing. Okay, so when helpless becomes the strategy, and that's why I said learned helplessness. When being overwhelmed brings more funding and efficiency, it's rewarded. Systems drift towards permanent dependence on federal rescue, political fights instead of engineering solutions, waiting instead of continuous improvement. And people start asking, how do we fix it, and start asking, who will pay for it? And that's really a trap. And like I said, with the medical system, the medical system the way it is, people are accustomed to, well, mom and dad always paid for my medical bills growing up. The vaccinations were free. The government took care of that. And now I'm 18 years old and all of a sudden I have to take care of myself. I remember my very first medical bill that I had to pay. I was like, I think I was 18 years old. I just turned 18 and I was having some kind of problem, I think shin splints or something like that, right? So I made an appointment with a doctor. I say, okay, I come in, and I went to the doctor and he's like, oh yeah, how are you gonna pay? And it just blew my mind, you know, because up until that point, my parents took care of everything. And here I am, 18 years old, and I'm like, ooh, how much does it cost for you? And back then it was like 1982, okay, 1982. And the guy said, well, I didn't really do anything. I just looked and I gave you a diagnosis. So, you know, an office visit for an hour is, I think it was like $85. And I just happened to have like, I think $90 on me. So yeah, I just pulled out some cash. Like, here's $85. And it just, I had, you know, I could not relate because my parents had always been paying for everything. You know, so I paid the bill and I walked out of there thinking, man, I'm going to have to do that all the time now. So I joined the military, and once again, you know, in the military, medical care is free. It may not be the best medical care, but it's free. And when I got out of the military, I started having to pay, you know, my medical coverage again, and I started paying through Blue Cross Blue Shield or Farmers or something like that. And then about a year later, I got a job at a place, and they provided medical insurance. But yeah, that's all kind of a structure of learned helplessness, you know, where, okay, mom and dad pay for it, fine. Military pays for it, fine. The place where I work pays for it, fine. So I, you know, the first time, you know, after that I really had to worry about it was, I think I was let go from my job for like a year and a half. And I think it was 2001, I lost my job for probably about 8 months, and right after losing my job, I went ahead and called up Blue Cross Blue Shield, and they told me the premiums, and I said, yeah, we'll go ahead with that. And so yeah, anytime I'm between jobs, I always call up Blue Cross Blue Shield, start paying premiums, and they cover me, and it's great. But yeah, it was a real shock to my system, realizing I gotta pay for my insurance. If I get sick, it's on me. I'm an adult. I have to pay for this stuff. And there are a lot of people who have never really learned that if they get sick or hurt or something, they have to pay for it. You know, they have to pay for their insurance and so forth. And the unfortunate thing is they really don't learn that until later on in life. And this is something that Andrea Salinas is, you know, she's trying to help out with. She's saying, you know, the government should really help out with insurance premiums, lowering the cost of medical care and so forth. And Donald Trump is trying to lower the cost of medical care, but ultimately, really, the cost of medical care, being able to provide your own medical care, your own insurance and everything, that's really what the individual is supposed to do. The individual is supposed to figure out how to pay for certain things. Groceries, a place to live, medical insurance, things like that. I mean, that's just something that being an adult, being an adult means you take care of yourself. If you can't afford things like, you know, your lifestyle, whatever your lifestyle is, you should change your lifestyle. I knew this one girl a long time ago. I dated this girl, and she was a terrific girl, but she always had a case of beer in the refrigerator. And back then, you know, she would go through, like, you know, she and I, we would go through like 2-3 cases of beer every week. And that was probably about $12 for a case, you know, so $36 a week. Well, you got to figure, you know, she's complaining, well, I can't afford food. So I would say, well, stop buying beer. And she'd be like, what? Stop buying beer? I'm like, okay, look at this. You spend $36 a week on beer. If you spent $36 a week on food, you could afford food. So stop buying beer. And she just kind of looked at me like, huh? And you have to have priorities. If you can't afford food, you certainly can't afford beer. All right? So it's really, you know, and this is something that I've said before. The whole purpose of government is to accomplish collectively that which the individual can't accomplish. The individual can accomplish health care. The individual can accomplish employment. If you are underemployed, go to a vocational school. Learn how to be a plumber, learn how to be a carpenter, an electrician, something like that. These vocational schools are generally very reasonable. You can go to the community college. The community college will teach you electrical, electronics, HVAC, things like that. And there are all kinds of construction companies out there that will give you a free apprenticeship. All you have to do, show up with the education, show up with the prerequisite education, be able to read, be on time, be reliable, and in the end of like 1 year, after a year of working for a construction company, you could be pulling in 6 figures. I mean, some of these, you know, plumbers, electricians, HVAC people, they will make more than $100,000 a year. And I'll tell you this, I'm a manufacturing engineer with a master's degree and 35 years of experience working in the industry. I'm lucky to make $175. Okay, generally speaking, a guy in my situation will make between $125 and $150. With all my experience and education and everything, $175 is pretty darn good. Okay, people with a good vocational training, HVAC, electrical, carpentry, like that, they can make $125, $130, $140 a year. So really, it's not up to the government to make sure that your medical care is covered. It's up to you. It's up to the individual. Because the individual is capable of doing it, it's not really up to the government. The government has to consider larger things like infrastructure that brings jobs to the area. The infrastructure is really key to the success of any area, because corporations will bring jobs to an area that has good infrastructure. With that infrastructure will come jobs. With jobs comes the ability to pay for medical care. With the ability to pay for medical care comes medical facilities. Now, I'm getting a little bit off the subject here because I want to talk about robotics in medical care, okay? So, restoring agency. Instead of systems that say, sit still, we'll handle it, build systems that say, here are the tools, let's solve this together. Agency returns when communities can lower costs through design, deploy capacity where it's needed, participate in prevention, and benefit from innovation, not wait for a rescue. A better question is not, how do we pay for this, but how do we make it fundamentally cheaper and easier to deliver care? That's systems engineering. And this is where I get into AI and robotics, okay? So like I said, here's the quality triangle with cost, time, and scope. That's a standard quality triangle. Quality of medical care has immediacy, availability, and affordability. Those are the three factors when it comes to quality of medical care. So AI robotics is a different approach. The goal is to multiply human capability, not replace human judgment. AI plus robotics can reduce administrative burden, improve diagnostics, automate repetitive tasks, extend care into rural communities, and lower cost per patient. Now, what we're talking about here, if you go to a medical facility, most of what you're paying for is the bureaucracy, because you have people who keep files, people who triage. You have a cleaning staff. This cleaning staff comes in, they clean everything, take care of it. The bed linen is removed, the urinal cakes are replaced, and all this stuff. A hospital is kept very, very clean because you come in and pay. The doctor comes in and puts stitches in your arm. The stitches might cost $8. But the doctor is going to cost $250,000 a year. And the rest of everything all combined is probably going to be a whole lot more than that. So every time you come in to get something simple done, you're not just paying for the stitches, you are paying for everything in the hospital that's happening. Okay, so that's one of the things that AI and robotics can replace. Okay, so what AI already does well is triage support, record summarization, early detection of risk conditions, documentation, charting, telehealth support, remote monitoring. Doctors focus on care. AI handles the cognitive load, which means if a doctor, let's say a doctor is saying, well, let me see, here's the symptoms. I've never heard of this before. Let's take Guillain-Barré syndrome, for example. Guillain-Barré syndrome, if you've ever eaten chicken that was a little bit raw, and you got a little bit sick from it, you had a bacterial infection. And that bacterial infection can trigger an autoimmune response called Guillain-Barré syndrome. And what this autoimmune response does, it causes your immune system to attack the myelin sheath that's on your nerves. And eventually, if it progresses far enough, you lay there in bed completely paralyzed. You are totally aware of everything that's happening around you, but you can't move. You're completely paralyzed because your immune system has consumed the myelin sheath on all of your nerves. Now, it very rarely gets to that point, but it does get to that point. Eventually, it's an autoimmune response. Now, very few doctors are actually familiar enough with Guillain-Barré syndrome that they can diagnose it just immediately. Same thing with rabies. Sometimes people will come into the hospital with symptoms of rabies and a doctor won't know it. Well, AI would be able to figure that out. And the great advantage there is if you have a doctor that has like 1 year, this doctor has gotten out of medical school and has got 1 year of residency, still isn't really enough of a doctor to be able to work without other doctors around. But with AI and robotics, one doctor that hasn't been around very long can do the same work as a huge staff of very well-educated doctors. So the AI, it will make it possible for a smaller clinic to handle bigger loads, is essentially. That's where AI comes in handy. And Oregon has got a terrific AI community. Oregon and Washington together, great AI community. We can work that out. We can make it work. See, that's what I'm thinking for Oregon. Okay, so what robotics already does well: lifting and patient transport, sterilization, logistics, pharmacy automation, assist surgery, repetitive rehab tasks, continuous vital monitoring. Robots equal precision and consistency. Humans equal judgment and compassion. So let's say somebody comes in and, like I said, they need some stitches done. There is actually a machine that they're working on, I believe, in Japan. It's either Japan or India. It might be South Korea. But this is a stitching machine. And I don't know how far along they are in it, but you see, that's the thing about whenever you're stitching somebody up, it's a very mechanical task. This is something that it's possible to get a machine to be able to do that. And a doctor who doesn't have a whole lot of experience would be able to prepare the area, you know, shave the hair off, put iodine in there, which is, iodine is still used in a lot of places as a disinfectant, okay? It's good to have a little bit of iodine in your system to prevent a thyroid condition called a goiter, but iodine is really a terrific bacterial fighting, so that's why they pour some iodine over it and everything and heal it, you know. But anyway, the whole stitching thing can be done by a robot. And so let's say you're one doctor and, you know, 7 patients come in and they all need stitches. Well, one doctor could come along and, you know, take care of this and take care of this, you know, set the stitching machine going and then take care of this. One doctor could handle 5, 6, 8 patients, where without the stitching machine, you know, the robotic stitching machine, the one doctor would not be able to do this. He'd have to get, you know, to one at a time, and 2 or 3 of the patients might bleed to death. Okay, so this would be an advantage for you know, any kind of clinic that's in a rural area. You can't spend a lot of money on a lot of doctors and a lot of staff, so you get robots and you get AI, and you're already like 90% done. So that's a good way to reduce the cost of healthcare, not by bringing in more money from the federal government, but by figuring out cheaper ways to do the actual work, you see. So I want to lower medical costs. I want to lower healthcare costs. I want people in Oregon, well, all over the world, I want people to be able to get the healthcare that they need. I don't want people dying from some simple, stupid thing. 100 years ago, if you got a broken arm, you know, 50% of the time you were going to die. If you got a broken arm, you might die. If you, the guy that invented Jack Daniels, well, he didn't invent it. It's Jack Daniels whiskey. The person who owned and, you know, started the company, he kicked his safe one time, got a broken toe, and he died from the infection. Okay, I mean, who dies from an infection from a broken toe anymore? Nobody does. That's the kind of thing that shouldn't happen in the United States. We should not have that kind of inefficient medical care. Everybody in America should get the health care they need. They should be able to afford it. But the way to make health care affordable is by automation and AI and lowering the cost of healthcare rather than increasing the amount of federal funds that come in to pay for healthcare. If you keep getting federal funds coming in to pay for health care, it's that whole learned helplessness thing. You know, why should we improve our medical facility if the federal government's just going to pay for everything? Why should we learn how to take care of ourselves if the federal government's just going to come in and take care of it for us? See, learned helplessness in a political perspective, in a healthcare perspective. That's what we're talking about there. So yeah, learned helplessness, bad. Trying to figure out how to lower healthcare costs through robotics, through AI, through technical innovation, very good. Okay? So, modular healthcare facilities also. Built-in factories delivered like mobile home style modules, urgent care pods, imaging units, surgical suites, monitoring centers, telehealth hubs, installed and operational in days, not years. Something like this right here is available right now. The only problem is that the paradigm is a big permanent healthcare system where, you know, millions and millions of dollars are spent and politicians get a whole lot of money from contractors. And this right here would provide medical care to rural areas, and the medical care would be great. This right here is surgical unit. You see this robot there on the right and the surgeon on the left? The surgeon on the left could be in, I don't know, Pakistan. And the robot right there on the right could be in Antarctica. So you see, you could have one doctor performing surgery in, I don't know, 17 different countries. Okay, you know, so you would have no, if you had that one robot in your modular healthcare system, you could have the best possible surgeons in the world taking care of your people in Chugwater, Wyoming. Okay, Chugwater, Wyoming could have a nice little modular healthcare center like this right here, and inside that healthcare center could be this little robot here, and that little robot could be part of a surgical network of the best surgeons in the world. Okay, so this would make everything available, and remember the quality triangle, availability. So why the modular works? Well, it's cheaper to build, it's standardized quality, fast deployment, easy to expand, easier maintenance. Infrastructure becomes flexible instead of delayed. And you see, this is an important thing, because if we want corporations to move to an area, then infrastructure is important, and medical care is also important, because you're not going to get important people moving to an area without some kind of good infrastructure, and medical care is part of that infrastructure. So that's why this is, you know, important. So AI plus robotics inside the modules, AI-driven intake plus smart sensors, robotic assistance for routine care, remote specialists on demand, automated monitoring, clinicians supervising the system, smaller staff, greater capability. And something that happens very often is poorer people who don't really have a permanent job. They work just, you know, odd jobs wherever they can. They still deserve health care. Well, a lot of times these people use the emergency clinic in a hospital as their own personal health care unit. And what happens is they're provided with emergency care because it's the law. A healthcare clinic cannot deny health care. If somebody comes to you with a broken arm, the healthcare clinic has to set that broken arm, has to take care of the person to a reasonable standard where that person can get up and walk out of the clinic. Now, whether or not that clinic gets paid for doing that is entirely up to the bill collections unit. Okay, most people are going to pay, some people don't. A lot of times people who are impoverished, they can't pay, so they come into the emergency room, they get the care that they need, they walk out of the emergency room, nobody ever hears from them again, they don't pay their bill. And, you know, to be completely honest, I don't really care, because I pay my health insurance premiums, and I realize that part of the reason I pay a higher insurance premium is because there are some people who are coming into the healthcare clinic, they're getting their health care and they're not paying for it. I don't care. Money is, you know, money comes and money goes. Human life is more precious than all the money that there is. All right, if they come in and get their health care and don't pay for it, it saves their children, it saves them. You know, I don't want everybody doing it, because if everybody does it, that's going to overload the medical system, and I don't think it should be made a matter of policy. If it does happen, I can't really hate it. I don't want everybody to do it. If you can pay your medical bills, pay your medical bills. And the fact that I really am not worried about it too much doesn't mean that it's okay for everybody to come and do it. It's something that should be done in an emergency. And you know, I really can't hate the people who have to do that. I understand these are difficult times, and I don't want a 12-year-old kid dying of an infection because he stubbed his toe on a cement mixer or something like that. Okay, I don't want anybody dying because they couldn't get the health care they needed. I also don't want to pay for everybody's health care. So socialized medicine is not a good idea. But, you know, and I hate to say this, I don't want to put it this way, but every once in a while, ignoring the fact that somebody's coming in and getting the health care and I'm paying part of it, you know, it's a matter of conscience on my part. And, you know, we wouldn't be human if we didn't have a conscience. We wouldn't be human if we denied access to health care to certain people. So it's something that I think we have to live with. But anyways, that's the situation there. I want health care to be reasonable. I want it to be affordable. I want it to be immediate. I want it to be available. I want quality health care for everybody everywhere. And the way to do it is to reduce the cost of health care and to improve the facilitization of health care. Okay? Built to improve over time. Traditional hospitals upgrade slowly and expensively. Modular AI-enabled facilities improve continuously, not every 20 years. It's a very important thing to understand. Okay, instant global AI upgrades. With AI, one update improves every facility. Outbreaks are detected globally. Diagnostics improve together. Best practices spread instantly. Knowledge travels at the speed of software. And that's something that's very important. If there's an outbreak, like with COVID-19, we knew that there was an outbreak of COVID-19. And President Trump tried to implement protocols that would have prevented the spread of COVID-19. But Nancy Pelosi came out and said, don't listen to what Donald Trump's saying. He's a xenophobe. He's a racist. He's just a weird old man. Go out in the park. Go to Chinatown. Meet with your friends. Have a good time. Spit in each other's mouths. Spit in the mouth of a total stranger. Okay, she didn't say that part, but essentially these protocols that were taken, the process to isolate that was taken, it was totally ignored. And even, you saw President Biden, he had his little mask on, okay, his mask, and every time he went to talk, he would do this. Yeah, blah, 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 blah. Oh, blah, 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 blah. It's like, okay, Mr. President, if you don't leave the mask on while you're talking, you don't even wear the mask. It's pointless. See, and that's the thing. Communication, if an outbreak starts someplace, communication through the medical network so that the medical network can put these protocols in place immediately will save humanity big time. Okay, so yeah, that's what AI can do for us. AI can immediately communicate with any situation that's happening anywhere. And if there is a doctor someplace that understands this situation, that doctor can, their AI can be like, okay, there's a person in Phoenix that has this infection, and there's only 3 doctors that actually are familiar with it. One's in Bangladesh, one's in Tokyo, and one is in Sydney, Australia. Well, each one of those doctors gets pinged, says, hey, there's somebody here with these symptoms. And those doctors call up that doctor and say, hey, it's Watsamata Doodle Doodle syndrome. Yeah. It happens because this little flea tap dances on a Pepsi can and causes Wasamadoodle syndrome, however, whatever. But the doctor in Phoenix is like, seriously? Well, what's the cure for it? Cornflakes. I don't know, something, like that. But yeah, that's what AI can do for us. Now, with AI, the most remote place in America, let's say Wyoming has got this little town called Chugwater. It's a nice little town. It's a cute little town, Chugwater, Wyoming. But let's say Chugwater, Wyoming has got a problem. Somebody has some kind of little medical issue that only the world's greatest brain surgeon can fix. They send this guy to their little modular medical facility with one of those little robot brain surgery tools, and the brain surgeon in Kuala Lumpur is able to operate on a guy in Chugwater, Wyoming within the hour. Okay, that's what robotics and AI can bring to the medical community, and can do it much cheaper. Much, much cheaper, because you aren't paying for a gigantic hospital in Chugwater, Wyoming. You're paying for a nice little modular hospital that the federal government can pay for. So, that's one of the reasons that robotics and AI in the medical care community can lower the costs without removing federal subsidies, okay? And this is something we can do in Oregon, because we've got medical facilities here, we've got robotic facilities here, we've got AI facilities here. All we have to do is put these research facilities on the idea of developing these modular medical units. You see, that's the kind of thing that I would be looking for if I go to Washington, that kind of thing, okay? So uniform hardware upgrades, standardized modules allow drop-in robotics upgrades, fast sensor replacements, predictable maintenance, mass-produced components. Upgrades become routine, not capital crises. Economies of scale. Mass production means lower cost per unit, consistent quality, simpler training, faster deployment, standardization, lower cost plus higher reliability. A learning healthcare network. Every patient interaction improves the system. Anonymized learning, better diagnosis accuracy, safer treatment over time, faster global response capability. Healthcare becomes self-improving infrastructure. The staffing model, human in charge. The humans will be in charge. Locally, there will be nurses, techs, paramedics, patient support staff. Now remotely, doctors supervising multiple sites, specialists on demand, AI safety oversight, AI assists. Humans remain accountable. Production principles at work, just in time. Just in time is something that manufacturing started doing in Japan. They call it Toyota Production System. We call it just in time, but deploy capacity where needed, when needed. Theory of constraints, that's something that a guy named Goldratt created in America. It's a great thing. Remove bottlenecks like staffing, transport, paperwork delays. The result is more patients helped at a lower cost. The economic impact. Healthcare stability attracts employers, families, investment, long-term growth, infrastructure to jobs, jobs to healthier communities. Okay, so from subsidies to investment, instead of endlessly funding the same broken model, redirect federal spending towards modular healthcare manufacturing, AI diagnostic infrastructure, robotic support systems, training people to operate and maintain them. This is not permanent rescue, it's capital investment on productivity like highways, same thing. Breaking learned helplessness. When healthcare is designed as permanent rescue, people wait. When healthcare is designed as evolving infrastructure, people build, manage, learn, and improve. Learned helplessness fades when people see effort produces results, innovation is rewarded, communities solve problems together, and success reduces dependence. That is the goal. Federal role, smart plus targeted. Fund pilot projects in underserved areas, set AI safety plus transparency standards, support workforce retraining, require measurable cost and outcome improvement, not endless subsidies. Strategic investment is better. Okay, guardrails, non-negotiable. AI assists for the humans decide. Transparency and privacy, independent safety audits, ethics and dignity protected, no fully autonomous life and death decisions. Innovation stays human-centered. What success looks like? Well, you'll get lower cost per patient, more health care in rural regions, faster emergency response, less burnout for staff, reduced federal subsidy dependence, real infrastructure where it didn't exist before, and most most importantly, those people who are using the emergency facility as their own personal health care unit, they will get the health care that they need, and you and I will not be paying for it anymore. It'll be the closest thing to socialized medicine that is affordable. You will see medical costs come down, medical care will improve, and these people who really can't afford health care, if they have to go to the hospital every once in a while for health care, it really won't be that expensive. So it'll be better for everybody, really. The closing thought here, the healthcare paradigm is simple. Keep pouring money into healthcare without demanding efficiency, redesign, or true cost reduction. Like any complex system, quality is driven by three forces: cost, what it takes to deliver care; scope, how widely and reliability the care is available; time, whether people receive care before it's too late. To improve quality, we must intentionally manage all three by applying proven manufacturing principles. Remember me, manufacturing engineer. Processes, discipline, automation, modular design, just-in-time thinking, and removing bottlenecks, we can create a healthcare system that costs less to operate, reaches more people, delivers care faster and earlier, and ultimately raising the overall quality of healthcare without the need for government subsidies. Okay, and that's all I got there. That's the raccoon of finished presentations. So I'm not sure of his name, but he looks like Dr. Evil Raccoon there. Okay, and here's the 10 top things that I want to do. On the proposed 28th Amendment for transparency and financial incentives, okay, I want to talk about that. Andrea Salinas, one of the other things that Andrea Salinas was talking about earlier today, I saw one of her little videos, and she said, yeah, the Trump administration wanted to get rid of $8 billion that's earmarked. Oh, green tea is good. For medical care. That's not exactly true. See, medical subsidies provided by Congress have to be reviewed periodically, and part of the compromise process is this. There are some representatives that say, okay, this sounds like a good idea, but we have to reevaluate it in 2 years. So we'll let it go for 2 years. After the 2 years is over, we have to reevaluate. We have to look into it again. So we'll vote on it again. What I have here is, back one, the 28th Amendment. My proposed 28th Amendment for transparency and financial incentives. What I'm talking about there is we need an amendment that decides whether or not subsidies should actually stick around. What Andrea Salinas was talking about, she's saying the Trump administration wanted to stop this from happening. The Trump administration did not want to stop this from happening. Part of the agreement of the subsidy that was created 2 or 3 years ago was that the subsidy would be reevaluated yearly or bi-yearly or periodically to see if it's helping, if it's hurting, if any problems are created. So it had to go in front of Congress to be voted on again, and what I guess she was afraid of was that the conservative Republicans in Congress would not vote in favor of it. But I guess they got enough votes in the House of Representatives to get that particular subsidy, I guess $2 billion or something like that, going again. And so this is one of those small victories that I'm talking about. One person really can't do everything in Congress. There are very few opportunities for one person to make a lot of progress. So the small victories are the things that every representative is going to be after. And this is one of those small victories. She's saying that she's part of a team, and this team that she is part of actually got enough votes to keep this subsidy going, which it's pretty standard, actually. This is a pretty standard thing, but it's a small victory for her. And you know, if she wants to claim it as a victory, fantastic, go ahead and do that. For me, I would be looking for a little bit more of a victory. I'm not going to be happy unless there is some kind of substantial change, and I think I could make that substantial change based on the fact that I have so much experience in the manufacturing and with industry. So, it's not that she's doing a bad job, it's just that she's doing the same job as everybody in the House of Representatives. It's that way by design, and nobody can really claim a huge victory. Everybody in the House of Representatives has to claim their small part of a major victory. So that's really what she's talking about there. And it's not the Trump administration that's preventing it from happening. It's just part of the compromise process that this bill will be reevaluated after a certain period of time. Okay, so anytime, those of you who support Andrea Salinas, fantastic. She's probably doing a good job. I'm not gonna get into that because, like I said, I don't want to talk badly about her. She's a responsible person. When this position came open in 2020, 2023, something like that, I guess she went ahead and ran for it and said, "Hey, I'd be a good representative," and so she took the position. So anyways, I think I can do a better job just based on the fact that I can apply my understanding of engineering techniques and manufacturing techniques to the political system and to the immediate needs of Americans. And I think I can bring jobs to Oregon from what I understand of the manufacturing system. Okay, so I support President Trump for the Nobel Peace Prize. I support Tulsi Gabbard for president in 2028. Make America great again. Yes, MAGA, but I am a Make Oregon 6th Congressional District America's greatest congressional district Republican. I am a Moskdagda Republican. And so, once again, I am Thomas W. Timbrooks. I'm running for the United States House of Representatives for Oregon's 6th Congressional District on the Republican Party. I want to make Oregon's 6th Congressional District America's greatest congressional district. Thank you very much for listening, and take care, and God bless.